One of the valves that controls the flow of blood through Josette's heart is broken, and blood is backing up into her lungs, which is why she can't breathe.
But how could this happen? Josette is strong. She's a net worker for the people of Haiti.
I have to get to Jachabel.
This week, a mudslide hit our village. So many people have died.
That might explain what happened.
You think Takotsubo syndrome?
Yeah.
That sounds bad.
Another name for it is broken heart syndrome. The mudslide may have caused Josette so much grief that it actually made her heart beat so hard that it tore the muscles that hold it together.
I hate to feel helpless. I'm sorry.
Well, the good news is I can fix a broken heart. Now we're gonna get you prepped for surgery and get you home as fast as we can.
First, may we perform a God call?
I'm sorry, what?
It's a protection ritual. We make a cut in the skin, rub in herbs.
Oh, no, that's out of the question. Any cuts to the skin can introduce infection, so.
God co attaches loi to me, protects me from accidents.
Okay, look, Josette, there won't be any accidents, all right? Now, if you excuse me, I have to prep for surgery.
Also, I got a call from Josette Campbell's family. Apparently, they're upset that you won't let them perform some kind of protection ritual.
That's correct.
Even though they believe it's going to help keep your patient safe from harm.
You fired the entire cardiac surgical department because of the high infection rates, and now you want me to let a family member cut open my patient and put dirt in her wound.
A superficial wound with a sterile blade under your supervision.
Is this my call, or are you overstepping me?
It's your call.
Good. And no one's cutting open my patient but me. Okay? Hello.
She's ready to go.
All right. Wow. Expeditions to the North Pole traveled ladder, huh?
Looks like V-fib.
No pulse.
Defibrillator.
200 joules.
All clear? Okay, got her back.
Back off the lever fed. That should stabilize her.
You good?
Yeah.
Back in V-fib.
I don't have a pulse.
Go 300.
All clear? Okay, I got her back. What the hell?
She's too unstable for transport.
Maybe you should do the ritual.
This pacing wire should get her stable long enough to get her to the OR.
Or you could do the ritual.
If I believed in rituals, I would have become a shaman, not a surgeon.
You're about to fix her heart valve. If I were you, I'd take all the help I could get.
You know, if a patient feels like they've got to chant or knock on wood or get their prayer warrior to lay hands on them before I operate, then that means they don't trust me. You know, faith in my abilities.
Normal pace rhythm with capture.
See? Pacing wire is all the faith I need.
O2 sats are falling. She's taking. Pulse ox dropping.
Josette, I'm going to sit you up so you can breathe.
Ready? Ready to innovate.
I hear Rawls.
Edema? Saturations
Backing
are
up in
down.
her lungs because of that valve.
Grab the chest
Hey, toss
tube.
me the furosemide.
I'm already on it.
Pulmonary compromise.
Monitoring. You know, it's gonna take a while to dry out her lungs.
Well, can't operate until I get this under control.
So then maybe you do the ritual.
Don't.
Plus 92.
That's correct.
Don't even say it.
All right. Normalizing.
Standing by.
Administering now.
Okay, look, the ritual isn't even about you or what you believe or your abilities. It's about her. It's about what she believes, what she needs. I mean, why can't you just give her that?
Let's get into the OR. Let's go slow. Here we go. Easy. Okay.
Ritual worked.
Just don't tell Bloom.
Who are you? What are you doing? Get out of here! Mom!
Lou? Lou? You okay? Okay, honey. Calm down. It's all right. We're just having another bad dream.
I can't breathe.
Yes, you can. You're fine. Just relax. Just take slow, deep breaths, nice and easy. There's nothing to be afraid of.
I'm trying, but I can't.
Relax. Slow, deep breaths.
I can't.
Lou?
Do you believe a spirit could be hurting your son?
No, of course not.
Because if he's been taught to believe that, it is possible for the fear alone to affect heart function.
I'm an engineer. I know illnesses aren't caused by evil spirits.
I'm sorry, I didn't mean to. I just had to check.
Holy crap.
I don't know what you're talking about. It was clean when we left.
You're telling us some random person broke into your house to dismember a pig in your son's bedroom?
A pig? My father-in-law. What did you do?
What you should have done weeks ago when the dream started. I'm saving Lou.
He's coding. Need a doctor in here? VTAC, no pulse.
Oh my god.
Push 1 milligram epi.
Paddles, charge to 50.
Charging.
Clear.
Still VTAC.
Charge to 100.
100.
Clear. Charging.
Wait. Normal sinus rhythm.
Tell me about the luau in his bedroom.
It's a traditional Hmong ceremony. It's supposed to call back the kid's soul.
Hasn't he heard of Star 69?
There's more. The reason Grandpa thinks the kid's soul is stolen is because he's convinced his son, the kid's father, had his stolen as well. He beat his boss to death. The dad didn't move away. He's in prison.
PTSD could definitely cause breathing problems.
It's not PTSD.
Even if the kid wasn't there, just hearing what the dad did.
But he hasn't. It happened when he was 2, and all he's ever been told is that his parents divorced and his dad moved away.
The heart thing indicates a malignant arrhythmia. He needs an EP study.
How many of the other files showed malignant arrhythmias?
None.
But forget the EP.
What about acute pericarditis? Explains the dyspnea.
How many of the other files?
It's exacerbated by lying supine, so the symptoms would get worse when he goes to sleep, just like all 100 of the others.
Do an echo to check the pericardium. See if you can find any cardioactive toxins in the home samples.
No, get away.
Look, this needle isn't nearly as big as the one in your arm, and that didn't hurt, did it?
I don't want it.
They need to do it, Lou.
You'll only feel a little pinch as we give you the numbing medicine. After that, you won't feel a thing.
No!
Lou, calm down. It's gonna be okay.
What's he saying? What's the problem?
I don't know.
He's saying it's too late. There's nothing we can do. It's Hmong.
He doesn't speak Hmong. He's never even heard it.
It isn't him speaking. It's the Da.
He sees it.
Oh my God.
Need some lorazepam in here?
Dang Tong Li Dua. It means You're a bunch of pathetic idiots at Hmong. Or it doesn't. But you would know, because none of you speak Hmong. Kid, on the other hand, is presumably fluent in gibberish.
The grandfather speaks Hmong. He translated.
He heard what he wanted to hear. Because if his grandson really is possessed, that means his son really is possessed, which is a giant step up from being a sledgehammering psychopath.
Whatever it was preceded a seizure. It's obviously a neurological symptom.
Scleroderma advanced to the point that it's affecting his brain?
Doctors say my brain is sick.
Your doctors are trying their best, but they're not looking in the right place. You know, I know this is a lot to put on an 8-year-old, but you have angered our ancestors by ignoring them. Now, do you remember how to talk to them? Yeah, that's right. Good. Now, close your eyes, and we will ask for forgiveness together. You're doing good. But we have to do more. The evil spirits are in the air, and the only way to stop them is by stopping the air. You have to be brave. I'm not trying to hurt you. This will help you. I know it will.
Lou? Are you okay?
I can't wake him up.
Lou? Lou, you're safe. You're in the hospital.
Get Grandpa away!
He's not here, honey. It was just a dream.
He was choking me!
No, Lou, it wasn't real.
It was! He grabbed my neck!
Those bruises weren't there before.
Liver failure can cause gibberish from encephalopathy, constipation, bruising, and breathing problems.
Hepatic fibrosis could hit someone his age.
So let's hit his liver. Get a biopsy.
God.
Was he?
Yes.
But hypocalcemia could. And the enema we administered to cure his constipation had a high phosphorus load, which could make him transiently hypocalcemic.
It's a long shot. At least it has the benefit of being rational. Go pump up his electrolytes and start beta blockers.
Nothing you've done has helped.
If you don't start and he has another seizure, the neurological damage could be permanent.
My father-in-law. He thinks the calling ceremony didn't work because Lou wasn't there.
And you think he's right?
I don't know.
I'm sorry, but there's no way we can allow him to perform an exorcism in your son's hospital room.
Then I will have to take him home.
Her kid levitated. That happens to my girl, I'm expanding my diagnostic horizons.
It's all the more reason why we should shut down. We cure this kid now, crazy grandpa and his magic beads get all the credit.
And since when do you care about credit?
Since when do I care about this kid? All I care about is sending mommy out into the world, having faith in faith. Kid's better off dead. As soon as she's done appeasing the gods, let's talk.
What about Kawasaki? Explains the irregular heartbeat, respiratory distress, and seizures.
It fits.
Which means he needs a coronary bypass.
Can't be Kawasaki. Echo would have shown it. But a patent ductus arteriosus...
It can't be a PDA. He's not an infant, nor has he had any symptoms for 8 years.
Maybe he has. Maybe he had an infected ductus, which we inadvertently treated with antibiotics.
So no evidence is evidence of evidence?
I'm just saying, it's consistent.
It's 1 billion to 1.
Which means there are 7 people in the world who fit the diagnosis.
I thought we were looking for 100.
Well, maybe PDA is more common than we thought. But idiot doctors like you...
You're wrong. But the treatment's just ibuprofen. Closes a malformed duct. Worst case scenario, he just doesn't get better.
We need to put him on the OR schedule.
His BP's dropping.
He's crashing. Call a code.
need to stop this.
I'm giving him the ibuprofen.
He's gonna be okay.
It worked.
No, it didn't. Mrs. Chang, the medicine I administered was a long-shot treatment for Lou's heart, but that's what's helping him.
Ibuprofen? That's for headaches.
I know it seems hard to believe, but it's true.
And I know this seems hard for you to believe. Honey, Grandpa was right. He saved you.
There were two things we thought were impossible. One of them wasn't.
You're gonna talk to the demon?
What choice do we have? If she's locked in a disassociative state because of some repressed trauma, I mean, maybe, you know, the demon can give us a clue that might help us unlock her.
Her sedation's worn off. She should be awake. Good luck.
Hi, I'm Dr. Charles. This is Dr. Reese. Could you tell me your name?
You're in the hospital. You're safe.
Is that your name?
Mom rat.
Take it easy. Take it easy. Little help, please. Push to her, said.
Got it. It's just gibberish.
Make some moon breath. Make some moon breath.
Not so sure about that. So, believe it or not, there is, in fact, the case to be made that your daughter is possessed.
What?
Not by a malevolent demon, but, well, by her 6-year-old self.
6-year-old self? What do you mean?
We suspect that this could be the result of a trauma she experienced when she was a little girl.
I don't understand.
It's called dissociative repression. Disagreeable memories or personality fragments are split off and then pushed down into the subconscious.
Yeah, in your daughter's case, this fragment has resurfaced and perhaps hijacked her entire persona.
How could you possibly know that's what's going on?
Well, aside from the bedwetting and the tantrums, the biggest clue is her language. It took me a while to realize this is not all gibberish. It's Lewis Carroll. It's a poem called Jabberwocky from Through the Looking Glass. Do either of you remember reading this to her when she was a child?
I didn't.
No, I don't think so.
No?
Wait. You did. When she was little, I remember.
Mr. Ferris, would you mind just reading a little bit of this?
Oh, this is ridiculous. Psychobabble. Look, my daughter's very ill. She's not a child. She's a demented adult.
Just humor me, please.
No, we need to take her to a real expert and not this quack.
Just read the damn book, Jerome.
No, I'm not going to do it. It's ridiculous.
In that case, will you allow me? 'Twas brillig, and the slithy toves did gyre and gimble in the wabe. All mimsy were the borogroves, and the momraths outgrabe.
No.
Stop it, you're upsetting her.
No.
Beware the jabberwock, my son. The jaws that bite, the claws that catch.
No, please.
Stop this!
No! Please, don't! Oh my God. I remember she'd be crying. She'd say it was the monster from the book, and I thought it was all in her head, but it was you.
Now see what you've done. I told you that she's unstable.
Oh, I always suspected you, but I didn't want to believe it. I couldn't believe it.
You're insane.
You touched her?
Oh.
You did things to her?
I've heard
Oh
enough
my
of this.
God.
I'm not listening to this anymore.
Oh, my poor baby. Oh, my God.
Dr. Reese.
How could you do that? A child, a little girl.
Leave me alone.
You destroyed her, you know
Dr.
that?
Reese, enough.
You are the demon, you!
Dr. Reese. You let this go, you hear me? He might be a monster. He's not the one who hurt you. He's not the one you want to be yelling at.
I'm sorry.
Look, you haven't had the easiest road.
Well, certainly not as bad as hers. How do we even begin to treat someone like her?
Well, same way we treat any victim of childhood trauma. Try and get those repressed feelings up to the surface so we can address them.
God talks to him.
It's not psychosis, he's just religious. The only medical issue that showed up on the blood work is low sodium.
No, you talk to God, you're religious. God talks to you, you're psychotic.
A lot of people experience their religion as something more than symbolic. That doesn't mean...
God ever talked to you when you were in the seminary?
No.
God's loss, our gain. He's either psychotic or a scam artist.
He was actually really impressive.
Well, yeah, with the burning bush and all. It's quite the show.
He was intelligent, polite, dignified. He's not a typical 15-year-old.
And he told Cameron God wants her to stop being pissed at me over the article.
God knows you stole Cameron's article.
He knows she's harboring vengeful thoughts.
I'm over it.
Yeah, I can tell that from the Berlin Wall of body language between you. I'm shocked that he picked up on it. Low sodium. Check for Addison's.
No pigmentation and potassium levels were normal.
Cirrhosis?
Liver feels fine. Transaminases are normal.
We should monitor his saline intake to correct the low sodium. No more than 1 MEQ per liter per hour. Let's push the patient history, see if there's any evidence of drugs or other delusions. I'll take care of it.
Boyd?
God doesn't want you to be afraid. He sent me here to heal you. You think he hasn't heard your prayers, but he heard them all, even the ones he didn't say.
Sorry. Boyd, come on. Let's get you back to your room.
In faith, all things are possible.
Let's go.
Lord, I call on you to relieve the suffering of your daughter.
Grace?
And make her whole again.
Hey, what are you doing? What is this?
He's just had a complex partial seizure. He's disoriented. He doesn't know what he's
Well, get him
doing.
back to his room. Now. You okay?
Why the hell do you let an unstable patient wander the hallways?
His leash broke.
The last thing a terminal patient needs is to hear somebody taunt them with a cure. She was freaked. She was angry.
And now she's not freaked and angry, as you are.
She says she's feeling better. Maybe not singing and dancing, but she's feeling just a little bit happy for the first time in months.
Sudden drop in pain can create euphoria. You should let her have her vacation.
Oh, that's great. And when vacation's over, when she crash lands from all this denial, she was dealing with her illness. Now her expectations are rising. And you're not the one who has to be there when all that false hope gets yanked out from under her.
MRI shows an abnormal area.
Tuberous sclerosis.
It's the right neighborhood. Accounts for all the symptoms.
All of them.
Leading cortical tubers identifiable. We can do this surgically.
Tell our patient congratulations. Soon his chats with God will be a thing of the past. Tie goes to the mortal.
I took some images of Grace Palmieri's cancer.
Yeah?
Her tumors shrunk.
Don't tell my patient. I want all records on Miracle Woman. Every test, every treatment she's ever had, every question she's ever answered in this hospital. Anything sent from previous doctors. Go back to neonatal if you have. Which part of keep them away from each other confused you?
They're friends. She thinks he saved her life.
Now, we have obligingly offered medical proof that his delusions are true.
They've withdrawn permission for the surgery. I put the lawyers on it. Her tumor shrank.
I'm on it. Tell Jesus that we need another 24 hours to normalize his sodium level.
He's already normalized.
Actually, tell Joseph. Jesus will know you're lying. And I want you and Foreman and Cameron to go over every line of every file on that woman.
Isn't he the one we're supposed to save?
The only way to save him is to prove that she is still dying. Pick any random guy off the street, bring him in here, examine him exhaustively. You will find at least 3 things wrong with him. This kid has tuberous sclerosis, a mild case.
But his tumors are growing.
We assumed that the tumors were growing because he's getting sicker, but he could have grown old and died and never known about them if he hadn't come here. We were looking for something that was more or less in the right part of the brain. It's like we found someone standing over a dead body holding a gun. We arrested them, didn't look any further. Well, sometimes people really do just stumble into a murder scene.
His fever's 103 and rising. If we don't do anything, he's gonna be chatting with God face to face real soon.
Fevers don't come from a long-term underlying condition. He's a garden variety religious nut who happens to have an infection. It's lumbar puncture time.
No, God told me no more of man's medicine. If we have faith in him, he'll make me well.
It's just a test. We just want to find out what's wrong.
God knows what's wrong. God will take care of it.
He's delirious and he's a minor. This is your decision, not his.
The kingdom of heaven is like a treasure hidden in a field, which when a man finds, he hides. And for joy, he goes and sells all he owns, buys that field.
Buy all the land you want. Don't blow your brains out. You're watching your son kill himself. He's out of his mind with fever.
Dad, if your faith is weak, I will fail. I need you.
I'm sorry. You don't even know what's wrong with him. God knows the answer. And I would rather leave it in his hands than yours.
Wilson, I need you to do your thing.
You do know that I don't actually have magical power.
I have faith.
You're better off trying to slip some antibiotics into a meal.
Which antibiotics? We don't know what infection he's got.
Go as broad as you can.
Forget it. Our best hope is your silver tongue.
What if it's not an infection?
Were you not paying attention when I was doing my murder scene metaphor?
What if the tuberous sclerosis is guilty? It had the gun in its hand. It was standing
It doesn't
over
cause fever.
It causes everything else. What if the fever is the innocent bystander? Fever could have been set off by something he picked up anywhere. Could have been a bug he got here.
Or a bug he gave here. He gave it to your patient. That's why her tumor shrank. The virus went after the cancer first.
Are you saying a virus attacked your tumor?
For 200 years, there have been reports of wild viruses that target tumors. Early 1900s, an Italian medical journal wrote up a woman with cervical cancer who was injected with a weak strain of rabies. I have no idea why they did that, but her tumor shrank.
You think he gave her rabies?
One of the virus types most prone to go after cancer cells is herpes.
Herpes encephalitis. It would fit. Seizure, low sodium, even the blurred vision. And it would mean, if you're right, Grace's cancer is coming back. You're not going to be able to convince them. They don't want any more tests. They don't want to...
They can't argue with the mark of Cain.
I'm not going to change my mind. No more tests. God knows the way.
Okay, let's start with the shirt.
What are you doing? What are you doing?
I'm on a mission from God. If you won't let me undress you, then strip.
What's he doing? What's going on?
That woman you helped, you gave her a virus.
Well, she's healed. I have a gift.
Gift is jewelry, socks. What you have is herpes encephalitis. The only way you could have transmitted it is by scratching one of your own sores and touching another person.
Herpes, that's something you get from sex, right?
Either that or cold sores. Your kid got from the sex.
No sores, no. My body's clean. They examined me when I came in. No sores.
Herpes hides. You have an outbreak, it goes away, comes back, goes away. Strip! You didn't have a sore when you came in, but you got one now.
Dad, I've never, ever.
You wonder why a perfect child of God should feel so desperate to purify his body that he needed to scarf down a dozen gallons of water a day.
Boyd, is he right?
Dad, no, he's crazy. Help me. Dr. Wilson, help.
God said no medicine, no procedures. Taking off your clothes doesn't count as either of those. This one's your call.
Son,
Dad, we have to have faith in me.
I have faith in the Lord. You, I trust. As much as you can trust a teenage boy. Take off your clothes.
Relax. A few Hail Marys, a little encyclovir. Picking up angels again in no time.